Hi everyone, how are you? It is Dr. Emily, founder of EBFA Global, functional podiatrist, human movement specialist, and CEO of Naboso. So we are speaking today about ankle joint dorsiflexion and some of the most common causes for limited ankle dorsiflexion, which is also known as equinus. So the term equinus is a clinical diagnosis for limited ankle dorsiflexion. Now, when we squat, walk, jump, move dynamically, we need a certain amount of ankle dorsiflexion as a way for us to load and potentiate the potential energy during dynamic movement. And that is done typically through your Achilles tendon. So you are potentiating the fascial fibers of our Achilles tendon. Now, if you notice that when you squat and when you walk, you are doing something in a compensatory way when you are moving through your ankle. Maybe you're doing a little bit of a pronation, you're turning your feet out, you're abducting, you do a early heel lift when you walk. All of these are signs of a limited ankle dorsiflexion. So some of the most common causes of equinus or limited ankle dorsiflexion are going to be broken down into two main categories. You have your soft tissue causes, and then you have your osseous causes. Osseous means bone. So soft tissue, what we're looking at, some of the big main categories is going to be an isolated gastroc tightness. In isolated soleus tightness, maybe you have an isolated posterior complex. So it's the gastroc and the soleus together that are restricting your ankle dorsiflexion. Or maybe instead of it just being tight muscles and adhesions, it is an actual spasticity. So this is going to be a little bit different presentation. It's going to be addressed a little bit differently. So you've got some muscular causes. And then what we have that's also soft tissue could be that you have a structurally short Achilles tendon. So we've got muscle tightness, muscle spasticity, and then structurally short connective tissue, or structurally short Achilles tendon. On our osseous side, we are looking at two different types of bony blocks. Now, the first one is going to be spurs. So you could get spurs on the front or the anterior aspect of the ankle joint line. This is often from maybe the second cause, which is an anteriorly shifted talus. So if your talus shifts forward, that then blocks the tibia and the talus from articulating around each other during dorsiflexion. Now, if that happens repeatedly, or you start to get maybe some traumatic arthritis, you have a fall or a severe ankle sprain, you can start to get spurs on the front of the ankle. So anterior ankle spurs can cause limited ankle dorsiflexion as well. So now some of the main ways that you can address these. Let's go into the soft tissue. So you've got an isolated soleus tightness. How do you differentiate this from an isolated gastroc tightness? This is done through what's called a silver skull test. So for anyone who's taken an EBFA training in our BTS level 1 and 2, when you dorsiflex the ankle, there's an assessment that I teach or our instructors teach where you are doing an open chain, they're lying on their back, and you're doing a knee extended ankle dorsiflexion test. If you hold that pressure and you bend the knee, if you get an increase in dorsiflexion, as soon as you bend the knee, that is considered a gastroc tightness. It was the gastroc that was restricting that ankle dorsiflexion. That is considered the silver skull test. So then that would help guide you. Do I need to mobilize myself or my client's soleus? Do I need to mobilize my client or myself, just the gastroc? Or is it actually from a combination of both of these muscles? Typically, you can tell this based off of the foot type as well. So in higher arches, it becomes a little bit more of a soleus dominant restriction. In overpronated feet, you typically see a little bit more of a gastroc dominance tightness. Now, when it has to do with our third, or the spasticity from a soft tissue perspective, is that this is not addressed through just traditional stretching. You do want to make sure that you're using some sort of vibration or a PNF type stretching, a contract to relax, something that's going to address the neurological side of muscular control. I personally like to use vibration rollers and power plate or vibration platform to inhibit the muscle spindles and allow that spasticity to relax. Finally, the fourth cause of the soft tissue restriction is going to be a structurally short Achilles tendon. Now, a structurally short Achilles tendon, you are born with it. It is something that could actually be a performance advantage. I have treated a lot of sprinters, Olympic level sprinters, and they usually have a short Achilles tendon. It makes them really fast as they're going through the sprinting mechanism. However, when we go through a proper walking or squatting pattern, we need a little bit more range of motion than sometimes that Achilles tendon can allow. You'll also see this in toe walkers in children. They'll have structurally short Achilles tendons, and then oftentimes toe walkers in children become early heel lift adults, or adults that when they squat, their heels pop up every time they do a squat. So the way that you address this is really you're modifying. You are avoiding maybe being barefoot all the time. You may want to avoid zero drop shoes because it might put too much pressure on the plantar fascia and the Achilles tendon. But outside of that, yes, address the soft tissue. Yes, you can do some SMR and trigger point release, but you're not going to lengthen that Achilles tendon to get your maximum ankle dorsiflexion like someone who does not have a structurally short Achilles tendon. And then, of course, there's surgery. Doing Achilles tendon lengthening is oftentimes what is indicated in these individuals. Now, if we go real quick over to the osseous ones, if you have bone spurs on the front of them, oftentimes those do have to be surgically removed depending on the severity of those. Those can be done through a scope, so the ankle scope. It's not an open procedure, so the recovery is typically quite quick. And then for the anteriorly shifted talus, this is where I teach some posterior talar mobilization. This is actually on the EBFA YouTube channel. If you go to youtube.com/EBFA fitness, you can see a mobilization technique. Now, this would be where you put a band in the front of the ankle and you're pulling down and lateral to bring that talus back into the mortise. Now, why your talus can shift forward is oftentimes if you sprain your ankle, you tear a ligament, you have ligament laxity, you do a lot of plantar flexion, you can actually start to shift and destabilize the talus in the mortise or the ankle joint, and it can start to shift forward. Similar to the way that your femoral head can shift forward in your hip joint. So as we recap, let's say you've been frustrated for limited ankle dorsiflexion. You don't know the cause. You have been working with your clients for a long period and you're like, I'm doing stretching and it's not working. This is where we're looking. Think in your mind, is it soft tissue? Is it osseous? If it's soft tissue, it has a soft end stretch when you do your maximum ankle dorsiflexion. Bony block, it's going to be a hard stop. Soft tissue, if it's just muscle tightness, obviously address it through SMR, trigger point release. Be muscle specific. Is it the soleus, the gastroc? Is it the complex? Or is it a spasticity? Do they have some sort of MS, Parkinson's, upper motor neuron issue, CMT, certain neuropathies can cause this as well? Or is it just a structurally short Achilles tendon and you got to work with them and tell them this is your reality. How do we work with that versus trying to get increased ankle dorsiflexion and you got a structurally short Achilles tendon. And then of course we went over the bony blocks. Make sure you always appreciate the role of a posterior talar mobilization, and how you want to make sure that you're doing the proper technique for that talar mobilization, which is why I encourage you to check out the video on my YouTube channel. Okay, if you want to learn more about ankle dorsiflexion, ankle plantar flexion, or how to optimize your foot function, please head to ebfaglobal.com. If you're interested in any of our certifications, these are both offered in person and online. I hope that you enjoyed, and remember, stay barefoot strong.